The Nova Scotia Pharmacy Regulator is here for the public. We're here to ensure that the public receives the best possible care from pharmacists, pharmacy technicians, and the pharmacies where they practice. Our approach to repositioning pharmacists in primary care has us actually working on the true barriers to the public being able to realize the full extent of a pharmacist's expertise in medications. We are demonstrating that pharmacist's role is actually a clinical role. Their role is to prescribe medications for patients that best meet their needs so they can realize the health outcomes that they're looking for and achieve their health goals.
Working as a pharmacist in Nova Scotia has changed so much for me. Initially when I graduated from university, I was a dispensing pharmacist and was very much in that role. I dispensed medications to patients and counseled them appropriately. And since then, my day-to-day is completely different. I'm working much more closely with the primary care team, conference on patient cases, and then go back to the patient and treat them accordingly, and having regular check-in points and monitoring them in terms of their labs, the doses, watching out for things like polypharmacy. If you want to go home at night knowing that you made a difference in the lives of the community members in which you serve, this is where you need to be.
When we prioritize the patient experience, we build trust. Putting people first means creating an environment where patients feel heard and are active partners in their own healthcare journey.
When a pharmacist can treat a patient's healthcare needs right in their community, it ensures that Nova Scotians get the right care from the right professional at the right time. I'm so glad we fully incorporated them into our healthcare system and they're working to their full scope of practice. I've stopped by many of our community pharmacy primary care clinics and I've seen firsthand how they're taking pressures off of our healthcare system.
Data is really foundational to the work that we do here. It really takes us from anecdote to evidence. StaffWise is our staffing and workload initiative for safety and effectiveness. We've collected over 1 million data points from each of the over 300 pharmacies across the province. We look at the staffing levels of each pharmacy. We look at the workload that each pharmacy is doing. And we've also really taken the time to look at pharmacy staff well-being. And so by understanding for each individual pharmacy in Nova Scotia what their staffing needs are, it really does help to ensure that they can meet those patient care needs in their community.
Nova Scotia needs more pharmacists. We have growing healthcare demands in our communities, and we are incredibly proud and excited about the work we have underway right now that is modernizing a licensure pathway for pharmacists in Jordan. We are modernizing licensure pathways in Nova Scotia so that it's competence, not circumstance, that's defining who can practice pharmacy in Nova Scotia.
At its heart, equity is about fairness. It's ensuring every qualified professional has a fair opportunity to practice here in Nova Scotia, regardless of where they were trained or where their life journey has been. When we modernize our pathways, we are intentionally breaking down systemic barriers that may have kept skilled people out of the profession. This helps build a pharmacy workforce that is more diverse and more representative of the communities we serve here in Nova Scotia. A healthcare team that reflects our population leads to better, more culturally competent care for everyone.
We're taking bold action in this province to change the way we deliver healthcare. And the NSPR and pharmacy professionals are a critical part of the solution. A willingness to innovate is the only way to make meaningful progress.
We need to all work together, the public, the professions, system partners, so that we do design a system that meets the needs of the public today and into the future.